intervention, issue of no drugs, no mosquito nets, all those things were there. So as a result, when patients even come to the clinic and you prescribe, you ask them to go and buy drugs. Somehow, why should I come to clinic without drugs?
The main problem is poverty. We don't have money in Nigeria. We have seen cases of malaria, I can say complicated malaria. We have been facing this one for longer years ago. Complicated malaria that kills babies, kills pregnant mothers. Even when you are not pregnant, you can die of malaria.
If you don't have money to register, and if you don't have money for the drugs, they don't attend to you.
When I was at the interior part of Nigeria, people don't come to the hospital because of malaria. They tell you it's a normal thing to have malaria. And when they have malaria, they go into the bush. They gather leaves, they gather concoction and every other thing to treat them for malaria. Whether they are half treated, completely treated, they take their fate. And people died.
The intervention of SuNMap has really been helpful. They know that once they get to the facility, they're going to get the drugs free. They're going to be tested free, whether you are rich or you are poor.
It is so nice because we are given anti-malaria drugs and we are given net and we have been sleeping under net till now.
With the intervention, we see the number of cases we've been seeing now, because people start using mosquito nets, people start preventing themselves, and the environmental cleaning, taking care of the personal hygiene, cleaning of the environment, the awareness is getting more. So as a result of that, the incidence of malaria is reducing.
The awareness is high. Everybody knows that when you have malaria, when you go to the hospital, you'll be treated.
After taking the FOS and the SP, I don't experience the malaria again. And even I and my family, we sleep under that net. So without the mosquito bites, no malaria. So we are living fine now.
I can confirm it that we are malaria free in Nigeria compared to them, because the availability of drug in our hospitals is okay.
The difference is so high. On the part of the health workers, we are less busy at times, I can tell you. But in those days, very, very busy tackling with this problem. But now that the patients are relieved, nurses are relieved, doctors are relieved, because when your patient is not well, you are not well. You will not sit down. You'll be running escalator, struggling that this patient should not die, this one should not die. By the time you are struggling with one, another one will come. We are, even our own self, we don't take care of ourselves.
The staffs then were not friendly. Unlike now, you walk into the health centers, the patients are treated like theirs, as if it is their children.
SuNMap, they gave us training. They are now having more knowledge concerning these incidents and cases of malaria. They have knowledge. Unlike in those days that we treat blindly. These days that they don't come with complicated malaria, you give them pre-treatment. Before they even get malaria, they are covered. So the cases are reduced, and the nurses, the work is reduced. The tension is reduced, and the burden on us is reduced. We are happy. Even we are encouraged to practice. Those that are looking at us, they want to come into the health system.
Before the intervention, the incidents were, let's say, 80%. But after the intervention, the things have started reducing to, let's say, about 40% presently. So that's about 50% reduction.
I feel more confident now than before.
Malaria is highly reduced in our country now.
It has been helped a lot because we are free from malaria.